Hello, thank you for joining us for another edition of this family-friendly series we are calling Between Two Pediatricians. My name is Dr. Alicia Apple, and I'm a pediatrician at the Matthews Food Rock Rimmon office.
And my name is Dr. Bao Nguyen, and I'm a pediatrician at the Matthews Food Woodman and Southeast offices. Today we'll be talking about two issues that have been brought up recently by parents and patients here at our practice. And those issues are anxiety and sleep issues. I would like to start talking about sleep. So Alicia, as the mother of a toddler, what happens when your son doesn't get enough sleep?
He's awful. He's just terrible. He doesn't do anything I ask him to do. He's clingy. He cries for everything. He's so fussy.
Yep, that sounds about right. And even my kids who are in 4th and 6th grade can become more easily frustrated and irritable. They don't focus well on their schoolwork, when they're not sleeping well, they just get really whiny. So as we start this discussion, please remember that sleep medicine is a specialty in and of itself, and that the facts and recommendations that we're providing to you today are drawn from several reliable sources, including sleep.org and healthychildren.org, which is associated with the American Academy of Pediatrics.
So how much sleep do children need, Dr. Nguyen?
I think that this is a really great place to start because it is information that a lot of parents don't know. So generally speaking, school-age kids need anywhere between 10 to 12 hours of sleep. So the recommended bedtime for these kids would be somewhere between 8 and 9 p.m. with a wake-up time of 6:30 to 8. And of course, that depends on your family schedule and your school schedule. In terms of teens, they usually can function on about 9 to 10 hours of sleep, with a bedtime being somewhere between 10 and 11 p.m. And a wake-up time of 7:30 to 9. And once again, those times can change depending on their school schedule.
It's really important for parents to remember that from night to night, their sleep schedule for their children should stay the same, roughly within an hour of their regular time. Consistency is key with kids. Weekends should try and stay to the same schedule as well. They're not considered a flexible sleep zone, and that's an important piece to remember.
So yes, so as I tell my patients, you can't get back the sleep that you've lost. So you need to make sure that you get consistent sleep each night.
So what does happen if a child doesn't get enough sleep?
Lots of things can happen when a child doesn't get enough sleep. So in general, I think most people think that kids get tired when they don't get enough sleep, but in actuality, they actually get more wound up and actually hyperactive as the day goes on. So they get increasingly overactive, and then as this behavior gets closer to bedtime, they become more resistant, and it's even harder to redirect them towards getting into bed. And the reality is they can't, at that point, manage their moods very well. And then over time, the behavior just becomes more difficult to change. And they also just get more easily frustrated, and they start arguing with the parents and teachers. In addition, especially for older kids, inadequate sleep has been associated with high blood pressure, being overweight, and depression. So it is important for us as parents to be invested in helping our kids establish a good sleep schedule, because good sleep leads to improved attention, improved memory, learning, cognition, and overall just improved emotional regulation and quality of life.
So let's talk about some practical tips about establishing a bedtime routine. A good sleep foundation is based on 3 things: routine, regularity, and setting limits. Your routine really needs to include good sleep hygiene. So this means setting the right stage to prepare for sleep. It includes turning off all electronics, including your phone, which I am very guilty of, at least an hour before bedtime. No TVs, video games, or computers should be in the bedroom. And if your child does have a phone, I recommend that you plug it in to charge in the kitchen or in your own bedroom so that it's not a temptation for your child at night. This time of no screens and low lighting is a great time to prepare your child's lunch for the next day, pack their backpack, get them to set out their clothes for school, put on their pajamas, brush their teeth, read a book, ideally lasting anywhere from 20 to 30 minutes in preparation for sleep. Going through the same activity every night, night to night, may seem repetitive to you, but for your child, it's really creating good cues for their body and their brain to establish that it's time for sleep. My toddler, for example, knows that every night, right before we turn out the lights, we read Goodnight Moon.
And one topic I'm sure you've heard from your parents is the issue of melatonin.
Yes.
Whether they should supplement their kids with melatonin.
Mm-hmm.
Well, there are ways to increase your melatonin without needing any supplement. And this comes to the point of basically setting the stage in your bedroom to make it conducive to good sleep. The bedroom should be dark. A dim light is okay, but bright lights, especially those that are white or bluish tinged, do not allow your body to produce enough melatonin. And of course, melatonin is the natural hormone that helps us fall asleep. Your body also needs to be cool. Cooler temperatures also helps to produce melatonin, so ensure that your child's room is not too warm. And the last piece of what Dr. Apple talked about, setting limits. We all know that there are some kids who towards bedtime will want to negotiate an extra story or sitting in bed and they just want to drag it out. But you can predict ahead of time if these requests are going to be made and set your own limits and say things like, we're reading 2 stories tonight, choose which 2 you want to read, or I'll check on you in 5 minutes if you stay in bed.
Even though all of our schedules have been really abnormal in the time of this COVID-19 pandemic, we do encourage you to resist the temptation to allow your kids to stay up later. Good sleep is so important for their development. As with all things involving parenting, consistency is key. Kids need to know their limits and where their boundaries are. This helps create stability in their chaotic and ever-changing lives. Not having a set schedule can increase the likelihood of anxiety and stress in your child, even in a toddler. Many pediatricians have noticed an increase in depression and anxiety symptoms in our patients and their parents since the onset of the COVID-19 pandemic. It is more commonly seen in older children who are more acutely aware of the current pandemic, but even younger kids have been experiencing an increase in anxiety symptoms.
So Dr. Apple, what are some common symptoms you would see as anxiety in kids?
That's a great question. So the anxiety, most important thing to understand about it, is the most common emotional problem in children. Older kids typically will complain of stress or feeling overwhelmed. It's a little bit more obvious. They can put a voice to what they're feeling. They often will have sleep problems. They will complain of added worries or concerns about little things, new fears that have developed. These usually revolve around social situations, family, health concerns, school, and can often lead to difficulty concentrating in school and poor school performance. Younger kids will usually present with behavior issues, sleep disturbance, tantrums, appetite changes, and even abdominal pain.
Okay, that is good to know, and a lot of different symptoms that parents might not think of. Mm-hmm. So if you as parents do notice these behaviors, we strongly recommend that you talk to your child's pediatric provider if you're noticing this, so we can intervene sooner rather than later.
What are some things that you tell parents to do if they are noticing these types of symptoms in their kids?
Yeah, I think generally speaking, for us as parents, it's important for us to validate our kids' feelings because to them it's very real. And if your child feels like you don't believe them, they may have difficulties opening up to you. And in talking with them, it's important also to stay calm and positive. You can set the tone for this conversation. You can set the tone in your home. And also emphasize safety measures and thoroughly explain the need for them. Some of the things that can help, especially with a younger child, as they go towards a tantrum, is turning off and on the lights, or making a loud noise, or being very quiet, changing the location of where this is happening, or trying to distract them, or give them a snack.
Yeah. For older kids and young adults, there are several ways that you can help them decrease their anxiety. The most important is to teach them how to take care of their own bodies. That means eating healthy, exercising every single day, or getting outside to play, spending quality time with their friends and family per guidelines with COVID-19. Do things that they enjoy and make sure that they're getting plenty of sleep at night. Deep breathing exercises and having some mindful exercises can also be helpful for older children and young adults. And then there's also the grounding technique that a lot of kids can implement in school if they're in an anxious situation at school. And the grounding technique consists of 5 things. So they need to name 5 things that they can see around them, 4 things they can touch with their hand, 3 things they can hear, 2 things they can smell, and 1 thing they can taste.
I think I've never heard of the grounding technique before, so I think that's really great.
Yeah.
So we hope that these recommendations have been useful for you. I think this applies to all of us, young and old. And do reach out to your child's provider if you have concerns about sleep or anxiety. Oftentimes referral isn't needed, and the provider can offer practical tips specific to your situation. And as always, we here at Matthews Blue Medical Group wish you and your family good health and safety, and we are here for you. Thank you very much.